everyone. I am excited to be with you for another Fertility Hot Seat. Hello, hello, hello. I'm also cold, so I made myself a nice cup of warm nettle tea, and I am ready to be here with you guys. So let's run down what my hot seat is. So those of you that are here know how it works. So once every other week, I go live like this on my Instagram page, and I pull on one of you at your choice, and I give you a free fertility consult, basically. So a couple things. I've been practicing Chinese medicine and helping women for many years. I've been a practitioner of Chinese medicine for 17 years. I am the author of this book, which has been an Amazon bestseller for the last couple years. And it's helped lots of women all over the globe get and stay pregnant. And so I have quite a bit of experience in helping women figure out and get to the root of their fertility challenges, and then let me come in and see how I can help you. Keep in mind, I'm not a medical doctor, right? I've just been practicing traditional Chinese medicine for, like I said, 17 years, and I have a ton of clinical experience. But if you want to come on live and share your story with everybody watching, and then also get free advice from me, what you have to do is request to join, and I will then bring you on, and we will spend 15 minutes hammering through the details of your case, and everybody watching gets to learn and ask questions, and we'll go from there. So all you have to do is you have to hit the request to join live button. I think it's, let's see. Yeah, people are excited. Everybody's waiting, but who wants to pull the trigger and actually ask to join? And okay, here we go. We got some people coming in now. All right, see, I think there's just like a delay because now all of a sudden there's a bunch of people trying to come on. Let me see. Who am I going to pick? I'm going to go with the very first request. Okay, here, you guys are so great. I love it. I'm going to go with the first request. Okay, Heather. I'm going to let you come on live. And just my camera. Let's see, connecting. Oh, there you are.
Hi.
Hi, how are you?
Great. I'm so excited to be here with you.
Oh, well, I'm so excited that you're here. So fun. Tell me what's going on. Now everybody's like, how do you request? How do you request? I think there's like a little delay, but that's okay. I'm happy you're here, Heather. Tell me how I can help, or tell me, yeah, give me the scoop.
I've been following you for the last couple months. I joined your fertility reboot, and I did the fertility reboot along with you and the other wonderful ladies that are in that group.
Okay. And how'd you like that? How did it go for you?
It was great. Yeah, it was great. It was really insightful. You know, I definitely learned a lot along the way, and I learned how to eat better and treat myself better. I definitely beat myself up for a very, very long time. So
many of us do. So I'm glad you're seeing the light, or at least getting exposure to the other side of it. Yeah,
totally. And we've had a long journey. Started in 2017. It's been one miscarriage after another.
I'm sorry.
I don't want to cry.
It's okay.
After going through treatments, IVF treatments, we were able to get pregnant multiple times with IVF, and it failed at week 8 to 10, somewhere around there. It keeps failing. We don't know why.
Were they ever genetically tested embryos?
Yes. Okay. Yes.
And you've done more extensive testing since?
Yes.
Yeah. Okay. Tell me more. Yeah.
So, this is just going to sound weird, and I'm just going to skip ahead a little bit. So I started to meet with Dr. Kafinas. I went through all of his blood panel. I have yet to actually get the results back. We haven't set up, a meeting yet with him. So I'm just still trying to, process this whole thing and trying to figure out what's going on. The crazy thing is, and I'm just going to put this out there, I took a pregnancy test today
You're
because
pregnant, yeah.
I, I missed my period about 7 days ago and it
Okay.
came back positive.
Okay. Okay. Well,
And
congratulations, but I know you're scared. Yeah.
yes.
Yeah. Yeah.
So I saw that you were obviously meeting today and I really, really wanted to talk to you. So I feel like it's kind of fate.
Yeah, yeah. Well, good. Oh, good. I'm so glad I could. It's so funny too because there was like three girls and I like went back and forth and I was like, no, I gotta pick this one. So yeah, good. I'm glad. So you had the blood work done. You don't have the results yet. You haven't had the consult follow up with him. Can you
No, not
call
yet.
the office like immediately and say I just got a positive?
I spoke to my RE only because I wanted to get like
Yeah.
the blood work done first.
Yeah.
And then I'm going to call them once I have the results of that and see,
Okay.
you know.
And then in the past, have they put you on anything like a baby asprin or
So I was never
prednisone?
really on baby aspirin before. I was on Lovenox.
Okay. Okay.
So I did that for my second IVF transfer, and that still didn't do anything. It didn't make a
Okay.
difference.
Okay. So you're not taking anything right now?
No.
Okay. I still would personally, but
Yeah.
so yeah, I would have the results, but I would still call Kofinas' office and just say, I just got a positive, this is what like get, if you can get a nurse or him on the phone or his son, I want to know what I can do because I think like the first line of defense is like a blood thinner, a steroid, and maybe like IVIG like treatments or something like that to help. Because if we know you're making genetically normals and then you're still miscarrying,
Yeah.
there's that piece that we want to come in and support from the immune system perspective. So if you have the Lovenox, personally, I would say, like I have one girl who's in a similar boat and has had several losses and just emailed me the other day, just finished the reboot and is pregnant. And she did an autoimmune protocol kind of for the last pregnancy and she still lost it. And so she was like, I was like, I don't fucking care. Like, I want you to get on the call, usually with Dr. Cher, and I want you to take all the meds and, like see what we can tweak or do differently. So I say that to you as well of like, I would at the very minimum do, the Lovenox. I would also, if you're still in the Reawaken, since you did the reboot, I would stay in that diet as much as you could too. So like from the autoimmune perspective,
Right.
the anti-inflammatory diet, I would take upwards of 3 to 4 grams of fish oil every day, which is a very good way to lower inflammation.
Yeah.
Eat a ton of vegetables, kind of like all the things we were doing in the reboot, lots of the bone broth and then, the mental emotional support too. But I would definitely call Kofinas because, they're just waiting on the results, but he would still know of like what you've done in the past and what didn't work. So it's like, if the blood thinner alone didn't work, then I would think that there's inflammation, not just the clotting factor issue. Right. And so,
Right.
So the fish oil should help, but then also could he prescribe, a steroid in the meantime until we get all the results back in? That's basically what I would ask.
Yeah, that's what I'm kind of thinking is, maybe going on some sort of steroid, until I finally have a consult with him, just so.
Yeah. And I've seen that before. Like I've worked with Kofinas, like I've had a handful of clients work with Kofinas, but I don't know them as well as like the Vidali Braverman group. And I've seen that before where they're still waiting blood work and someone gets pregnant and they just kind of like put her on a standard, like a baseline protocol and then adjust as needed.
Right.
But a lot of the reproductive immunologists will do additional blood work once you're pregnant too, and then adjust meds accordingly. So to me, since you already are in his loop and have paid for that, initial round of bloods, I would just give a call and just get on their protocol. Because, chances are everything's healthy with this, pregnancy, this baby, if you will. And so now it's about your body. And also I have seen that the diet, the diet that we just did in the fertility reboot will really help. So as best you can to stay on it, or at least because we're in the early reawaken, right? Did you see changes in symptoms or red flag symptoms when you were doing
I mean, I also have a history of rheumatoid arthritis, so that also makes me nervous. And I know I have a history of autoimmune issues, which is basically the reason why I had signed up
Yeah.
for the reboot, only because I knew going into it that I already had red flag symptoms. I had swelling in my joints.
So you could
Sometimes,
even get a rheumatologist to see you have any
yeah.
prednisone.
And the
Yeah.
crazy thing is, I've spoken to my rheumatologist numerous times, and he's told me time and time again that it has nothing to do with pregnancy.
Yeah.
And this is,
He just doesn't know the
right.
data, if you will.
So this
Yeah.
is like a medical professional telling me that it doesn't affect pregnancy, or rheumatoid arthritis has nothing to do with it. But I did see an acupuncturist. Been seeing her for a while, and she was the one who told me to go see Kafinas.
Okay, good.
Um,
Oh, I lost you. I can't hear you. Wait, I can't hear you. I don't know why. Let me just, oh, there you go. Okay. Yeah, so your acupuncturist told you to see Kafinas, and then I lost you after that. Then
yeah,
what'd you say?
yeah. And so she was the one who kind of told me, like, we need to get the inflammation down. Like, there's definitely
Yeah.
something holding you back there. So I do trust her opinion, and hearing all you have to say about inflammation, really, it does resound with me,
Yeah.
and I feel like that has a lot to do with it.
Yeah. And then do you have okay, so supplement wise, what are you taking right now?
So Kafinas has me on like a
Oh yeah, all his
huge,
stuff. Yeah, the
yeah,
shitload of stuff. Yeah.
yeah. So it's a laundry list. It's zinc, it's the prenatal, it's vitamins D and E, I believe. It's the fish oil.
Yeah, and how much of the fish oil? Does he does a higher dose, I think, too.
Yeah, I think I had to take it about 3 or 4 times. I don't remember, to be honest, off the top of my head.
Okay.
I can go grab
Okay.
it if you want me to go grab it. But
No. It's okay.
okay.
Um, so yeah, I would just make sure, do the math on the back. So it should be like over 3,000 milligrams a day is what you should be taking.
Okay.
And then make sure the methylfolate, I think he puts everybody on the Matank, so I think you should probably be covered there.
Yeah.
And yeah, gosh, my instinct is like, lots of bone broth, like, like the liver support juice, like that kind of stuff that we were doing in the reboot. And I'm not a medical doctor, so I really can't say this like live on this thing, but like if you have steroids in your home, you might consider taking them right now. Or at the very least, call one of your physicians and get a clearance on that. But
Yeah.
I think Kafinas would do 10 to 20 milligrams of a prednisone. And considering, the rheumatoid arthritis. But I really think he's the one to call, and just because you're already under the fold and in the mix. And just my assumption is going to be that he's just going to put you on a baseline protocol and then have you come in for more blood work and reassess and help manage the pregnancy. But the Lovenox and the steroids seem to be kind of the game changers along with the diet. So I feel like you're doing all the right things.
Right.
And then it's just, so did you get the blood work back yet from the RE or no? Oh,
Sorry, I lost you for a second.
did you get the blood work back yet from the RE?
For this,
You said you went in for blood work just to confirm the pregnancy?
No. I called them. I'm gonna go in tomorrow.
Okay. So can you call Kafinas today too?
Yes, I will.
Okay,
100%. Yeah. 100%.
Do that. Because sometimes it's like the sooner the better with the meds.
Yeah.
And then he probably will recommend an IVIG as well, and I would do it.
Yeah. And that's just intravenous. Okay.
Yeah. It's like immunotherapy basically, but that will, all these questions are coming in, guys. I'll get to your questions that don't pertain to this case after I finish with Heather. It's an opportunity to pick my brain, I suppose, about anything, but or Beth is there answering questions too, guys. So I see the questions coming through, but yeah, it's immunotherapy. So it'll basically help. And sometimes you have to do it more than once in the early stages of pregnancy, but help your body basically not reject the pregnancy.
Right. Okay.
Because in the past, you just did the Lovenox, nothing else, and it didn't work. Right. And diet-wise, you weren't doing these things. Were you on like gluten and dairy back then?
Yes, I was.
Yeah.
So.
Okay. Yeah. So, I mean, I think you're in much better shape. Like if the diet, like considering we just came off the reboot, if you can stick to that as much as possible. I know it's hard in pregnancy because you don't always feel great, and but bone broth I feel like is pretty soothing or whatever. You know what I mean? Like figure out the things you can do. Stick to the gluten-free, dairy-free, soy-free. Take the higher dose of the fish oil, and then I think if you can get on the blood thinner and the steroid as quickly as possible.
Yeah.
And then maybe the IVIG. But I do think there's a good chance that you have to keep this one.
I hope so.
No. And I think too, like emotionally, just, you know, talk yourself through it. Like, don't, you know, a lot of what we covered in the reboot, like really acknowledge, like, I'm paranoid right now. I'm scared. And it's like, yes, I want nothing more than to have this child, but you also have every right to be scared right now.
Right.
And, you know, be easy on yourself with it. Like, just meet your anxiety and just, I think, sign up for the fact that, like, you know, and I don't mean that there's going to be any problems, but it's not going to be an easy ride emotionally the first trimester. It's just not.
No. And I'm already like mentally preparing myself for that. And I know that there's work that needs to be done around, you know, just being positive and trying to
and don't
keep
force
my
yourself
spirits
to be
up.
Positive too.
Yeah.
Like, you know, note that too. Don't force yourself to be positive, because I feel like that could be false in the sense of like, just sit with yourself of like, I'm scared because I've been pregnant before and I've had miscarriages before and I'm scared, but there are some things I'm doing differently, and hopefully, you know, this is the special sauce this time around. You know what I mean? It's like, you want to be here. And I think you called in, you know, a team that's going to be more supportive of what you've been through. And so, you know, you just ride it as much as you can. And it's like, okay, my body knows how to do this part. Like, I know how to get pregnant, and now it's the staying pregnant part. So now I'm going to call in, like, I'm going to try something differently this time. I'm not going to do it the same way.
Right. All right. Well, thank you for your time. I'm going to go make a phone call now.
Okay. Yeah. Go make a phone call.
Yeah.
And then please message me and keep me posted. Okay.
I will. Thank you.
Okay. I send you so much love. Okay.
All right. Thanks so much.
You're welcome. Okay. Goodbye. Oh, well, that was really nice. I was so excited to have Heather on, because that seemed very timely for her and really important for her to get that support. And so, yeah, good luck to Heather. Let's all send her lots of love. And, you know, it's scary to have had so many losses and nothing's wrong with the embryos. And that's, you know, I've seen that case quite a few times, unfortunately, numerous times at this point, dozens of times. And so I think she's with the right doctors that can give her the right support. And so I hope she gets, you know, it's the diet plus those immune medications are really important in a case like this. And so I'm so happy she's already working with Dr. Kofinas. He's a great immunology doctor. And I think give her the right support. But what she needed, I think, was a real nudge to pick up the phone and call him and, you know, dive in. Okay. And so I see a lot of these other questions have nothing to do with Heather's case, but I think Beth has been in there answering questions. So let me see what I can do here to support. I know I saw some questions coming through. Okay. I feel Heather's emotions. I know I did too. Sending her so much love. You guys are so supportive. Yay. Yeah, you guys understand how she's feeling. I love that. Okay. I have been concerned every month. I'm about to get my period to get all the pains what my period gives, but there's always a slight light brown discharge. Is this bad? So meaning a full flow doesn't come on, you just get the brown discharge. So it could be a mix of stagnation, cold, and deficiency. Just kind of depends. Just finished my cycle, had a lot of blood clots, no cramping now, and no breast tenderness. Okay, but still clots. So your body's passing something out. The period is a vehicle for the body to cleanse itself. So to see that, so the clots are a sign that there was some clogging in the uterine lining. If less pain, if you used to have pain and clots and now you just have clots, that's moving in the right direction. But we still want to process out those clots. So I always think of like castor oil packs in the follicular phase. I have a video on when and how to do it. So just Google Aimee Raupp castor oil or ask us on here and we'll private message you the link. Castor oil packs, dietary changes, you know, like the ones I mentioned in Yes, You Can Get Pregnant and Body Belief, Chinese herbs, if you can get your hands on them, acupuncture, that type of thing will really be helpful. What are your thoughts on cod liver original by 7C's omega-3? Yeah, I don't know. I don't know that brand. Let me see, 7C's. I see. Oh, I see it. I don't know this brand. Let's see. So I don't know it. I would just do more research on it versus I don't know it, and I only know the ones from Weston A. Price that they recommend. I don't think it's on that list. You can Google search Weston A. Price recommended cod liver oils, but I have the list of the ones that I recommend on my website. Can you use castor oil packs for blood clots? I'm happy. Yes, absolutely. Castor oil packs for blood clots. What do you recommend for 1 day period with very light bleeding? Your book says blood deficiency. My acupuncture says dampness. Yeah, it could be both though. The dampness is encumbering the spleen, so the spleen can't absorb the nutrition from the food and then it can't make blood. So it's actually both. The dampness might be the primary issue, but still I would do dietary changes. Like that's the number one thing I would do. You know, watch the gluten, the dairy, the soy, eat more warm cooked foods than cold raw foods, you know, all the things I talk about in the book. And if there are other dampness symptoms, then to get to the treat of that. But if the acupuncturist can put you on herbs, I think that would be great. Castor oil packs. I'm getting night sweats going through menopause. I'm only 33. I don't know. So I can't answer that. I don't know about your case, but night sweats aren't always indicative of menopause. They're indicative of estrogen shifts. So some women get night sweats right before their period starts. That seems to be pretty normal. It's very common where they get 1 or 2 nights of sweating before, and that's basically when estrogen's dropping off. So to us, it's just a sign of what we would say is like heat's rising because there's not enough fluid to put out the fire. And so, you know, to me, again, if that you're the same one that has the light period, then that's another sign of blood deficiency, in my opinion. But it could also be like there's dampness and blood deficiency. They can coexist. So it's doing all the things that I recommend in the book. And that should help. 43-year-old woman with normal progesterone, would you still recommend a natural progesterone supplement? No history of pregnancy or miscarriage. So no, there's no need to supplement if you have healthy levels of progesterone. The UVA is the best. It's hands down my favorite test. I have them right here on my desk, Aimee, because that's how often I talk about them and recommend them. So this is what I would get, the UVA. Go on my website under Aimee's recommended supplements, and you'll see all the information on checking out the UVA. But that will tell you what your progesterone is even beyond, like into your cycle, into your luteal phase. So you can check your progesterone on a regular basis and see what it is, and then if you need to supplement or not. I have your book, but it doesn't mention dampness. It mentions probably spleen chi deficiency and blood. Let me see. So I talk about the spleen, which is, let's see, chi deficiency. So I would look under chi deficiency for you, and blood deficiency. So chi deficiency leads to dampness, basically. So I would look at the chi deficiency aspect and work on that, but really follow the dietary recommendations across the board in the book. Any progesterone you recommend and dose? If everything's in normal range, I don't recommend progesterone though. If it's not in normal range, it depends on how abnormal. Maybe it's a doctor prescribed progesterone, or there's some over-the-counter ones that are good. I like Progestavel, and I recommend taking it as recommended, but only in the luteal phase. So once you ovulate. Are IUIs a waste of time? No, not for some people. They can be very beneficial. It depends on the case. Depends on what's going on too. You know, it really just depends on the case. What are your thoughts about removing mild uterus scarring? How fast is the recovery? Will retrieval lateral implantation? Yeah, it depends on the scarring. If it's excessive, then I've seen girls have procedures for uterine scarring or Addison's, and it helps, and then they go on to conceive. So it really does depend. I do like castor oil packs and my abdominal massage as well for that. How fast is the recovery? It really just depends. You know, typically it's just one cycle. If you went in and did like a DNC type of thing for the scarring, and then the next cycle you should be good to go. But some people have complications with the removing of the scarring. So I think you come at it with from all the sides. I would do, if you were still to do the surgical procedure, plus I would do acupuncture, I would do mind massage, I would do castor oil packs, I would do Chinese herbs, I would do all the things to just really amplify uterine receptivity. I'm still taking liver and cod liver. Is baby aspirin good to take? It depends on the case. So I don't know your case well enough, but if there's a history of miscarriages and you've seen a hematologist or had a clotting factor panel and been recommended baby aspirin, then I do recommend taking it if you are pregnant. Cod liver oil and liver will thin the blood a little bit. Sometimes that's enough for people, but some people need the baby aspirin as well. So it really, again, just depends on the case. Could chronic endometritis lead to elevated natural killer cells? I would think so. Theoretically, yes, it's inflammation, and then there would be elevated NK cells. So sure. Why is endometritis there is the big question, and how to treat it. I've taken low-dose steroids, had a miscarriage, and been told by other doctors it's necessary to start steroids before getting pregnant. So I've seen all the different cases. I've seen girls start steroids the way Heather is going to start them and it work. And I've seen girls start them before and it not work, vice versa. It really depends on the case. Sometimes it's the amount of steroids. And I do too really feel like the diet plays a huge role. So she's following my Body Belief diet. So that's the autoimmune protocol. And I do think that combined with all the other things that the steroids are more effective. Could you elaborate on the stagnation with brown spotting before a period? Well, it's hard when I don't know all the details of the case, but basically if there's brown spotting, 1 or 2 days, I think 1 day with a little bit of spotting when you're wiping could be totally normal, not a big deal. If you're seeing days of brown discharge before a period starts, it's some things I think about are not everything cleared out from the last cycle. So there's stagnation there. So the uterus didn't totally empty. When I see it to be brown, I think old blood, dried blood. I think it might be cold in there. So I also think about, is there a progesterone deficiency? Is there a thyroid issue? All these things layer in, and then I have to look at the case deeper and decipher and figure it out. Is the Amazing Grass Greens powder okay to use during pregnancy as well as leading up? Notice it has maca and green tea in it. Yeah, I think it's okay. Like, I'm very much a less is more once a woman is pregnant. So stopping things that have unnecessary ingredients like extra caffeine or maca once you're pregnant, I would stop. So if that's the case, if you're worried about it now preconception, then I would just go to plain old spirulina that doesn't have anything else added to it. Breast soreness with ovulation. No, that can be pretty normal for a lot of people. It's just a sign of, a little bit of stagnation in your body. So I'm so redundant, but castor oil packs leading up to ovulation really make a big difference. Some exercise around ovulation, like a good sweat too, right around ovulation can help. Should we avoid eating nightshade vegetables if we have endometriosis? I recommend, strongly recommend doing a elimination diet and seeing which foods aggravate you. Nightshades can aggravate an autoimmune client or an endometriosis client, sorry. I should characterize that. Not all endometriosis isn't always autoimmune, but it has autoimmune characteristics and typically responds well to an autoimmune diet. But I would do an elimination to see if you respond negatively to them or not. Curious how you advise women who have spouses who are not supportive of the Body Belief diet. My doctor has me following the diet. Husband does not like that I am gluten-free. It's none of their business, I mean, obviously you want to have a supportive partner. I think that's important. So I think it's a bigger conversation to have of just like, these are the ways you can support me. And it doesn't feel good if you don't support me, but I'm doing this for me, and you can do it or not, let's decide, let's make a pact to not talk about diet anymore. Like, how I choose to live my life is how I choose to live my life, So I think it's a bigger conversation too. I was diagnosed with POF, just started reading your book. Well, good. Hopefully it will give you some insight and help you. Sending you love. The diet isn't imposed on him, by the way. Yeah. So I think it's, you know, and when I say bigger conversation, I mean, I think it's like a bigger relationship conversation of like, how else is he not supportive, or how much support do you need from him to make your own dietary choices? You know, that's another thing too, of like, my husband doesn't always follow what I do. It's his prerogative, you know. Is L.Ac good to take in addition to the other supplements that are in Body Belief? It can be. Again, it depends on your case, but L.Ac is good for COVID too, because it's good for the immune system. So generally speaking, I think 600 milligrams a day during the time of this pandemic is actually good for most people. My progesterone came back at a 13.1. Is that too low? Not necessarily, you know, and it's progesterone can change every single day, which is one thing I've learned from the UVA. So once you're in the luteal phase, it can jump around and change. So, you know, it just depends. But if you're not getting pregnant or not staying pregnant, then maybe it's too low for you. But I've seen girls carry pregnancies with progesterone at that level. What are your thoughts on primrose oil for dryness, especially down below? I mean, if you're applying it topically, maybe, but dryness down below is still a sign that there's dryness on the inside, that there's estrogen deficiency, these tissues aren't getting hydrated. So I still like to look and try to fix from the inside out. And I don't love evening primrose oil because of it can be too estrogenic and be a little disruptive to hormones. So I use other things like even coconut oil or olive oil for a topical, or my sweet love butter. But then also making sure eating tons of fat and good quality protein and things that are really going to nourish and balance your estrogen too, Chinese herbs. How long to take bone broth before I see a difference? So, I mean, I think 3 to 6 months on the lifestyle changes before you really see major differences. Some people see differences right away. Some it's long-term, but to me, you know, it's bone broth is the kind of food that I think anybody could benefit from eating on a regular basis because it's so good for our immune system and good for the gut health and the gut lining. So, you know, it really just depends. You know, on all the things, and it's frequency and consistency is what I say. And so if you're looking for balancing changes to see in your hormones, it's at least 3 to 6 months before you really see all the things you want to see. Is oatmeal dampening? It can be. I think it's a good question. I think especially like obviously things that like if it's ready-made oatmeal with like sugar added and stuff like that, absolutely it is. If it's like the one that you cook on your own and it's the slow cooker kind and it's organic and non-GMO, potentially not, but it is kind of thick and viscous. So anything that's thick and viscous can be very dampening, you know, so it just depends. How do you feel after it? Again, elimination diets to me are the be all end all, because then I can really tell what's going on and how a person feels after eating each meal. And if they give you, you know, gas or bloat or impact your digestion, or you feel a sense of heaviness or fullness, like that too fullness feeling, it could be. So I know that's a vague answer, but it really is like a case-by-case basis. Like I had a call earlier today and I was like, you know what, maybe we should pull the oatmeal because maybe that's the thing that's actually upsetting your stomach and maybe making it hard for you. So can I take cod liver and super omega-3 as a repetitive? It's a little repetitive. Some of my girls do a little bit of each so as not to overdo it. Would you stop maca once you detect you're pregnant? I would, personally. A good sweat for stagnation is hot yoga or running. Okay. Yeah, maybe more. Yeah, I think either or. It's not too much. I don't want too much sweating, but sometimes a good sweat will actually do it. Okay. Is this video available on YouTube? It will be. What do you recommend to get my cycle back after miscarriages? My temps are still quite high. So Chinese herbs and castor oil packs. I know I'm so redundant in acupuncture. Those are the best to get things out and move on. And I'm sorry about the loss. Have a red rash on my chest for 6 months. Can't seem to get rid of it. Does this have to do with hormones? Maybe. Diet, again, you know. Um, again, I don't know enough about the case to help. I'm sorry. But maybe, I mean, I would look under all the things. Like, if it's everyday consistent, it's got to be diet. It's got to be diet or stress levels, something you're exposed to on a regular basis. If it comes and goes, then maybe it's more hormonal. Best way to get chronic endometritis cause. Could it have been back-to-back miscarriages? Absolutely. It could be back-to-back miscarriages. I don't know that we'll ever know the actual cause, but we do know that it's inflammation. We do know that it's an infection in the uterus. And so, you know, you do want to think about, like, you know, from a Chinese medicine perspective, we then use the period as a means to help really clear out the area, and Chinese herbs. Okay, guys. So becoming into a large Q&A. I'm going to have to wrap it up now. So, I'm going to answer these last two questions and then I'm stopping. Okay. I love you guys, but I have to. Recently discovered I have subclinical hypothyroidism. So Ari put me on 25 milligrams of Synthroid. Does it change any supplement protocol? No, shouldn't at all. You should absorb them better. 41, my AMH went up from 1.9 to 3.2 after dieting and acupuncture. Wow. About to do IVF in January. Keep doing what you're doing, because that's a great improvement. AMH went up after diet and acupuncture changes. I love that. You know, the mental emotional piece and talking to your body, acupuncture is great prep for IVF. Castor oil packs, not once you're on the meds, but before. You know, just keep doing what you're doing. Frequency and consistency. Oh, you guys are so sweet. Okay. All right. I love you guys. I'm going to go. And I'm sending Heather so much love. Heather, please keep us posted on everything. Okay.